Good morning, and I want to thank everybody for coming to this press conference today. We are kicking off for the 4th edition Texas on the Brink. This is where Texas ranks among the 50 states, and today we're going to talk about healthcare in Texas. This document ranks Texas in a whole host of categories: education, healthcare, air quality, criminal justice, others. But today I think the real news is where we are in healthcare. Contrary to what Governor Perry told us in the State of the State speech, Texas lost 25,000 jobs in December, and as of January, 220,000 Texans were on the uninsured, had claimed unemployment insurance. We have 5.83 million Texans without health insurance today, 1 in 4, making Texas the least insured state in the nation. Not a single Texas city even reaches the national average in citizens with health insurance. From 2000 to 2007, Texas families saw their health insurance premiums soar 86.8%, nearly 6 times more than their median earnings increase. Today, 29 cents of every private pay health dollar goes for denial management and administration, not to direct care. In other words, Texans are paying more for less health care. When it comes to health professionals, Texas has fewer physicians and nurses per capita than any large industrial state. Nationally, Americans can expect 214 doctors for every 100,000 Americans, but here in Texas that number is 171, and in places like El Paso County, it's 109 physicians per 100,000. The Texas border is the least insured with the least health professionals in the country. Now I'd like to go through that with you to show viewers today that are watching this where we rank among the 50 states just from a statistics point of view. We're number 50, last in the country in the percentage of population with health insurance, and last with children with health insurance. I'd like to get down there to the obesity rate, which I think is going to be a major issue in this session and sessions to come because of the public health costs that reside in the issue of obesity. Mental health expenditures per capita were 48th in the country. Today, every single one of our mental health institutions in the state of Texas, all 13 schools, are in a Department of Justice lawsuit. Next slide. This is a map on the Texas uninsured. When you look at the darker areas, that's 35% to 46%, meaning they are the least insured in the state and in some cases the country. And as you trend lighter, that's where you have more health insurance. So if you look up in Denton and Collin County, up there in Region 3, you have higher rates of insurance. When you come to the border and the Panhandle, you have less rates of insurance. But the key number I'd like you to watch is that one on the left. The national uninsured rate is 15%. 15%. Next slide. Not a single Texas city reaches the national average in health insurance. This is a chart that was prepared by the Comptroller's Office. This is released when Carol Keaton-Strayhorn was a comptroller. She called me when she got these numbers back and said I had no idea. No Texas city reaches the national average in the number of citizens covered with health insurance. So let's find the national average. If you look up there, it's 15% in blue, U.S. national average. Let me come over here. So that's the U.S. national average. Let's find your city. If you're from Austin, Texas, you're in gray. This is Austin, Texas. If you're from Laredo, Texas, it's this color blue. This is Laredo. And if you're from El Paso, Texas, you're red at 33%, which is the uninsured rate in El Paso, Texas. And so what you're looking at there is a shocking representation that most Texans, I think, don't know. There's not a single city that reaches even the national average in folks covered with health insurance. Next slide. When you look at major Texas cities, there you have the percent of uninsured. El Paso at 33, Dallas at 25, Houston at 27. Next slide. And let's break it down. This is what a U.S. city would look like in the Northeast and the West Coast. 70% would have commercial private pay insurance. Federal programs, Medicare, CHIP, Medicaid, TRICARE would be another 30%, and in that, the uncompensated care uninsured. Next slide. This is what the statewide payer mix looks like in Texas. 50% are covered with private insurance. The uninsured is about 25%, And then you have another 25%, which are Medicaid, Medicare, TRICARE. Next slide. Now let's start watching as these slides move from the north part of the state to the south part of the state. This is the important part of this pie chart. This is 62% in Tarrant County. This is Fort Worth, one of the more insured counties in the state, have commercial private pay insurance. They have a manageable 23% uninsured, and you see the mix here between CHIP, Medicare, and TRICARE. Next slide. Now let's start moving south. Bexar County. This number is now 45%. Went from 62 to 45%. What's the uninsured? You're 25% uninsured, a larger Medicaid population, larger Medicare population, and a larger TRICARE population due to the military in Bexar County. Next slide. And here's El Paso. 32% have commercial private pay insurance, and now the uninsured is larger than the insured. There are more uninsured folks in El Paso, Texas, than insured folks in El Paso, Texas with private care. You have a larger Medicaid population, larger Medicare population. TRICARE is not as large as San Antonio because we don't have the same number of retirees as Bexar County has. This is unmanageable when you have this segment of your population being uninsured. And when you have over 220,000 Texans who now have filed unemployment insurance, you're going to have more and more Texans losing employer-based health care. That, to me, is the story of this session. Next slide. Let's go to physicians. These are the large industrial states that Texas is normally ranked with. You can see the national average per capita is 214 physicians per 100,000. Texas is here at 171 per 100,000. Next slide. This is where the shortage areas are in the state of Texas. If you notice, when it comes to south of I-10, healthcare shortages, lack of insurance, this is the capital of that for America. These border counties have fewer physicians and less access to health care than any other counties in America today. Next slide. This is a physician shortage for 2008. These are, again, per 100,000 population. Next slide. This is border area physicians. This is a comparison chart. You have El Paso versus the state. So physicians, 109 versus 159. Physician assistants, dentists, 18 to 37. In every category of health professionals, you have a shortage in El Paso, Texas, and indeed anywhere along the border. Next slide. The other issue that's facing us in terms of healthcare is the rise of obesity. You can see here that the number of obese Texans has doubled since 1991. This represents a chart that shows the growth of these rates. The higher the obesity rates, the darker the areas. You can see Texas hangs with southern states in terms of the obesity rates. And in the West, only Colorado is 10%, 15% and under in the western states. Next slide. This is diabetes, which is, of course, connected to obesity. And that's it. Why are we putting on this press conference today? We need to draw attention to the health crisis in Texas. When 5.83 million Texans don't have health insurance, 1 in 4, when another 220 have claimed uninsurance, we have to deal with the fact that Texans have less access to health care than other states. This session we've filed several bills that will address this situation. The first I'd like to draw attention to is Senate Bill 577, which would take CHIP to 300% of the federal poverty level and creates full coverage buy-in as an option. The other that I think is very important is Senate Bill 349 relating to 12-month Medicaid enrollment. This is particularly important when you see how many folks are going to be impacted by the crisis relating to the credit crisis in Texas today. I've asked Mrs. Carter to come here to relate her experience if she could. She was insured in CHIP and had a son that was injured, and she's been kind enough to travel to Austin today to share her story. If you could. Thank you so much for coming.
Hi, I'm Joyce Carter. I am the mother of a 13-year-old. My son's name is Nigel Cleveland. He was injured during football practice. Him and another student had ran and hit their knees together. I took him to the doctor, and they x-rayed him and told me that his bone had moved, had shifted to the left, and that his bone was very bruised. that he may have some torn ligaments. So when I got home later that day, I got a call, and they said that he was no longer covered under CHIP. And of course, I called and I asked them, you know, what was going on. They told me that they removed us from CHIP because we qualified for Medicaid. So I called Medicaid. Medicaid told me no, we did not qualify because of our income. So again, I called back CHIP, and I mean, they never documented the times that I called, the reason that I called. And I mean, it's very frustrating because my son's knee had needed to be seen. He needed to go to a specialist, and I had to cancel the appointment because we had no coverages. So his leg got worse and worse, it's swollen more and more. And I mean, I was unable to do anything because we had no coverages. So I again called, like I said, I called CHIP over and over, many times, a lot of times a day. The application that they did send me previous, I did fill them out, returned them. Nothing had changed in our income, so I didn't understand why we were taken off of CHIP. I was just hoping that maybe this situation would change. The reason why is a lot of uninsured children in Texas, you know, not at their own fault, and that this would help a lot of families that need coverages, that are approved for coverages, that they may get the coverage that they need. Because, I mean, it was a wake-up call for me and my son, and it was horrifying. Thank you.
Thank you for coming. Can we go back to the slide on Texas cities? With that, I'd open it to any questions. Well, I hope, certainly among lawmakers I talk to, there's hope. The cost of that ranges anywhere from $40 million to $100 million, depending on the buy-in option. If you have sliding scale premiums, you can craft a bill where GR is rather minimal, as low as $20 million a year. The high is 100. If you put in 100 of GR, you can pull down 300 of federal money and cover, how many kids would that cover? Another 100,000 kids in the state of Texas. Every session we come down here, and every session we talk about the will to cover kids with health care. There seems to be will for tax cuts, but not will to put kids in care. And hopefully we'll get that message across Texas. I think we'll get help as the economy worsens, because people are going to be asking for this kind of legislation in Austin. Yeah? Well, that's been a long-running issue at Health and Human Service, how we intake folks and do an effective job of that. El Paso had the best outreach program in the country when CHIP first came into existence in 1999 to 2000. In fact, our office led the coalition that got kids into CHIP in El Paso. In 2003, with draconian cuts, families looked up and said, "Where's CHIP?" And a lot of them didn't go back, didn't make the monthly premium, didn't think the program existed. Well, the program's back, but the fear has not gone away, and you have fewer people that have decided to trust CHIP and get back into it in El Paso. I think there's two issues. One is, do we have an effective outreach program to get all those who are eligible for the program into the program? And second, have we fixed at the state level the intake process so that folks like Ms. Carter can give their information, talk to a human being, access the program, and qualify for the program? But I don't want to get, I want to stay with this 12-month Medicaid enrollment. By far, the greater number of kids are in the Medicaid program. And so if you have a 12-month enrollment, you don't have to do that every 6 months. You're doing it once in 12 months. And then the re-up program is a lot less onerous to families. What we're finding in our community is rationing by frustration. People like Ms. Carter spend so much time on the phone, talk to so many folks in Austin that they can't get the coverage, and so they quit trying. And that's not the message we want to deliver out in places like El Paso or Lubbock or Houston or Dallas.
Separately, you mentioned obesity and that being a major issue in the session as well. Can you elaborate a little bit on that?
When you look at the rise of obesity that's in that chart, it comes from two things. One is sedentary lifestyles, and second is the kinds of food that Texans are eating. when calories are consumed in fast food diets, what you're seeing is folks that end up weighing 300 pounds in the 8th grade. When that happens, it will be a quality of life issue, and it'll be a public health cost issue. We have the most effective obesity program in El Paso to deal with obesity. It's called the CATCH program. And in the school districts, we have an effective exercise program that's been in place for 10 years, and we're connecting thousands of families to better nutrition. So if you look at a county-by-county chart, El Paso doesn't reflect the trends of the other parts of the state because of that program. We have several bills filed this session to connect school districts to locally grown products, to ban trans fats in certain classes of restaurants, to improve school nutrition, and to make much more effective programs in schools with respect to exercise. The CATCH program is the model, and I think you'll learn as the session goes on that policymakers here in Austin want to look at that as a model to take to other parts of the state.
CATCH is an acronym.
It's coordinated something. It has something to do with outreach and exercise in the acronym. Well, let's get back to the pie chart, the El Paso pie chart. First, let's talk about El Paso. We have an acute health professional shortage. Why? Because we have 67,000 troops and dependents coming. That will require 2,200 new nurses and 680 new doctors. If we don't actively recruit those professionals, if we don't grow our own in El Paso, then what we'll see is professionals drawn from one system into the other system. So for us, we have to solve this issue in the next 4 years. Why the border has so few health professionals is linked to this chart. When you have 1/3 of your population with no health insurance, you're going to have less doctors, less nurses, less healthcare access because there's no money to come with the system. And you find that chart up and down the border. That is accurate as to the 32 counties that reflect the Texas-Mexico border today. And for us, access to health care, access to health insurance is one of our top issues. In El Paso, it's acute because of the military, because of the expansion of Fort Bliss.
So how do we go about addressing that? Insurance is one thing, but do we need to train more doctors, more nurses?
Well, I think there's two approaches. First, grow your own. That means more slots, residency slots for doctors. Means more faculty in nursing institutions, means more slots in nursing institutions, and then import. And the import strategy really has to do with bringing in licensed professionals from other jurisdictions that are already practicing there and making sure that they can enter into the market in El Paso, Texas and other places and practice. I'll give you an example. If there is a doctor that is coming over with the troops from Germany, then why can't that doctor who's been treating that troop 10,000 miles away do the same work in El Paso, Texas? So among these bills, you'll see a provisional licensing of physician bill that if a physician is in good standing, has no complaints, has passed the boards in one jurisdiction, they can come here and practice pending licensure in the state of Texas. That will go a long way to alleviating some of the issues we see in El Paso, Texas, because a significant percentage of the health professionals we anticipate will come with the troops. I want to thank you guys for coming today. Really appreciate you being here. And these materials are in your materials that we gave you today. If you want copies of these slides, we can email them to you. Okay? Thank you all for coming.